As part of an initiative from the residents of Al Yarmouk area, the first health city in Kuwait has been established. The city has gained the recognition of the World Health Organization, has been readied with medical equipment and staff to receive and treat COVID-19 cases. With us is our correspondent Hadil Fahed from Al Yarmouk area. Good afternoon. How will this step help in building a stronger and healthier community?
Hello, Claire. Good afternoon to you and good afternoon for everyone. Yes, in this crisis, not only the government institutions and in the branches working, also the individuals. At Yarmouk area, where I'm right now, in Layla al-Qurashi, the residents of Yarmouk area turned it to a field hospital. To give more highlight about this field hospital with us, Dr. Ghassan Al-Athman, the director of the Yarmouk Field Hospital. Good afternoon, Dr. In the beginning, we want to know how was the idea born to establish this field hospital?
Yes, thank you so much for your time. Back in March, early March, when the cases were surging in Italy, France, and Spain, there was a considerable amount of death happening of COVID-19 patients, simply not because of the health services, poor health services, but rather due to maximized capacity of the health services. And that trigger of why not the contribution should come from as well the community, so that this is a contribution, a community engagement, a social responsibility aspect of the community to find their spot on the map of confronting 19. From that perspective, the boards of executive boards in the Yarmouk Healthy City, I discussed with them the idea, and we expanded that idea more, and then we found a tremendous amount of response from the community beyond the expectation. And the medical school students, they contributed significantly to this project, so everyone came together for a greater cause and to support and supplement the work of health.
Okay, so doctor, can we talk about what's including, and we can see that a lot of medical team. Can you give more details about it?
It has to become of medical team, administrative team, the ability to run security team, and an innovative team, which really works with problems that we face, and they resolve innovatively and creatively. The medical team is mainly made out of both the medical students who volunteered on their behalf, and as well the presence of the medical staff and the nursing staff from the Yarmouk Health Center nearby, which is very close to proximity to this school. And putting all the efforts together, we concluded that we needed to look after the 15% patients who saving their lives with only oxygen and IVs, and as well just medical monitoring and caring. Capable, if we train the patients or the whole team to how to handle the patient and protect themselves, and use all the equipment, as you can see, from oxymeters, flow meters, monitors, beds that we innovated differently as well to match the requirements of the patient, and as well the medical staff and the nursing staff looking after the patient. Now, in case problem happen, and in case the person or the patient gets more complications, what will happen is that we've innovated as well an ambulance car, which patients can be transported to intensive care. So we are only looking after the 15% of patients and not the 5% who require hospital admissions. This is strictly a field hospital that was done by the people, for the people, according to high standards by WHO and CDC.
Something important that I want to highlight about it and to mention it, that the supporting from Yarmouk area to the volunteer that under 18.
Yes, there was a considerable number of volunteers who weren't able to be on the field, and they could contribute significantly. So I thought differently. Let them work from home, but they joined the innovative team, and we have an excellent creative, innovative person who's 17 years old, and she, Noor Al-Abeid, we all mention her with pride, because she was able to actually go through the specifications and come up with a great solution where we can use and recycle plasmids that are tailored to in accordance to high standards and specifications according to CDC specifications.
And let's last question, please. That's supporting from Ministry of Health and specifically Sheikh Dr. Bassel Sabah.
Yes, we thank Dr. Bassel Sabah for his visit, recent visit, and he came to us, and we were very proud for his comments, which were praising and as well full of astonishment. He came to us expecting a regular standard field hospital, but he was surprised, and the standard that we have provided by both donation-wise and volunteer-wise.
Thank you. Great job, Dr. Ghassan Al-Athman. Thank you for your effort, and also thanks for the residents of Al Yarmouk area, where they are trying to support the Ministry of Health and also to combat this COVID-19 pandemic. And let's say something important, that Kuwaiti citizens that confirm again and again that they are working hand by hand. And thanks for all the efforts that made by the government and also for the cooperation from the citizens and the residents. Let's back to the news with you, Claire.